So we're here at Sanoviv Medical Institute with a team of our professional doctors, nutritionists, scientists, and we're just talking about Lyme disease.
This is the medical team of Sanoviv. Since we are doing our protocol with whole body hyperthermia, I can say that we are changing the life of many people that has Lyme disease, chronic Lyme disease. And to send a message of hope for people that is out there, that we totally understand how you feel abandoned and frustrated for not having the medical system supporting you. Two very important effects from the whole body hyperthermia and the hyperbaric oxygen therapy in this program to improve the microcirculation or to open those tiny capillaries that normally at this temperature and at this pressure they are closed. So the heat makes them, to be opened. And the pressure from the hyperbaric that people has here during these 2 weeks are making all this good stuff that people is receiving intravenously, including the antibiotics, to penetrate all over the tissues where Borrelia burgdorferi and the other little rascals could be hidden, And the idea is to wash out all these things. And the whole body hyperthermia do this along with the hyperbaric. So are two synergistic effects that you don't get in many places. If you get an IV, even if you get an antibiotic orally, good luck, to get that antibiotic where these bacteria could be hidden. If you get it intravenously, you increase the chances, but it's still the microcirculation is not in favor. So here we maximize that.
It's not just people from Connecticut have it, all around the world. So here being that we put the person as a priority, seeing the backdrop, going into the functional medicine approach, into lifestyle medicine approach, into analyzing, seeing all the symptoms that are very complex, and then applying with great diagnostic tools that we have. We utilize the TICFlex, we have it in-house with the greatest advantage of it being a hospital setting. Things happen quickly. You get excited when we're able to pinpoint and bring to a person, hey, you have chronic Lyme disease. And I've had people cry of joy because they know what they're facing and they're not crazy.
What makes the protocol unique is that everything is done under the same roof. All the therapies, ozone therapies, whole body hyperthermia with antibiotics, hyperbaric oxygen therapy, our Tezted, intravenous ozone therapy, colonics, everything is done with a path, with an intention and under the same roof, and that for the patient it's really comfortable and effective at the same time.
Our psychology team, it has the most experience as any other psychologist in treating Lyme. There's PTSD due to the not being diagnosed and having the disease.
And overall, the support that an individual with Lyme disease have that we can support, as you can see many colors here, there's different disciplines, psychology, nutrition, all the things that are usually people don't know how to handle. And the aftercare that people receive after they leave here is very important because we do need to keep up with our patients, guide them. It's all fine here because they're under one roof, but when they go home, they still need that support system.
Lyme disease is a label, it's a diagnostic. In the medical system, we need those labels to put together an understanding the condition, but you need to acknowledge as well that it's a condition in a patient, and the patient is a whole thing. And when patients come here with a diagnosis of Lyme disease, after having this integrative approach, they learned that it's way more complex. But the solution is given as well, because as this multidisciplinary team, we can identify the priorities, and we have a daily medical meeting where this is a room for that, and we discuss every case is presented, and you hear brainstorming, everybody feedbacking each other what we found in our patients, so we can prioritize the approach and the therapies. And when you work with a group of professionals that are connected, it's even more powerful because it's not only one single doctor in front of the patient. It's a group of specialists that are really thinking from multiple angles the best approach.
And then having the knowledge that between departments there is a strong communication I think this is something that makes the patient feel safe in a very relaxed environment.
When we get a patient here, they have been doctoring for, I don't know, 15, 10, 20 years. And they're tired of being treating themselves. They're so deeply in a dark hole where they don't know what else to do because nobody believes them. You know? And that, you just tell them that like they can't just release all that burden, medical burden, that it doesn't belong to them, it belongs to the medical system that probably due to a lack of diagnostic tools and treatments has abandoned those patients and classified them as psychiatric or something like that. They just get depressed, tired, and just not willing to live, you know. And here we can just like take care of that part, you know, like that's our job. That's, let us pamper you while you're getting better, relaxing and enjoy the journey, you know.
Mm-hmm. And our program per se is quite powerful. This whole body hyperthermia is, there's many research about how Borrelia burgdorferi is affected by the heat. The membranes of this bacteria is debilitated. So this approach gravitates around the heat therapies with many IVs, and even we can use antibiotics for being sure that we are eliminating the bacteria from the body, or at least reducing the Lyme load. And there is as well many benefits from the whole body hyperthermia in the brain.
I remember a patient saying at the end of her stay that she got more diagnostic and treatment in 2 weeks than the last 20 years.
Yeah, absolutely.
Because they were able to do everything at one place. People very professional.
Everybody's like that, you know, like giving all that love to the patient because they have been, well, not understood for years and years of being suffering, and the patient, what it needs, it's just that care, you know. And I think Sanoviv is really, really good on that. There's hope, for sure. There's hope on diagnostics. There's hope on treatments. There's hope for everybody, you know. Not because in one place they told you something that it was in your head, or because it was fibromyalgia or something, I don't know. You don't need to live like that. You know? There's options. There's people who's like us willing to help you guys to be better, to live a normal life, and to be happy.